Welcome to the deep dive. Sometimes you hear about someone who's just considered the person to go to in their field, like truly exceptional. Today, we're digging into what makes that happen. We've got some fascinating material here about one particular specialist. We're focusing on Dr. Gulshan Sethi. He's been called Long Island's best vein specialist. Big claim, right? So our job today is to unpack that. What does the source material tell us about why he has that reputation? What makes him stand out?
Exactly. It's not just about the title itself. It's about figuring out, well, what does the best actually look like in a specialized field like vein treatment? What qualities, what practices does our source point to? And maybe what can we all learn from this about spotting real expertise, not just in medicine, but anywhere?
Right. We want to give you a quick but, solid grasp of what's behind his success based on what we've found. Our source really lays out a kind of blueprint, so let's get into it. Okay, first things first. The source kicks off highlighting three core things about Dr. Sethi: exceptional expertise, advanced techniques, and compassionate approach. Now, you hear similar things about doctors sometimes, but for someone to be labeled the best, there has to be something more significant here. What makes this combo so foundational?
Well, yeah, you're right. It's how they fit together. It's not just a list. Exceptional expertise here probably means like a really deep, nuanced understanding of venous disease, not just textbook knowledge, knowing why things happen, the hemodynamics, recognizing subtle differences between conditions. That allows for, super accurate diagnosis.
Okay, so the expertise is the bedrock. What about the advanced techniques?
That piece is crucial too. Phibology, vein treatment, it's changed a lot. Advanced techniques likely mean things like laser ablation, radiofrequency,
Yeah.
minimally invasive stuff. These are procedures that target the bad vein from the inside. Much less recovery time, less pain than older methods like vein stripping. Big difference for patients.
Right, I've heard about those. Much better than the old ways.
Definitely. But having the tech isn't enough.
Right.
That links to the third part, the compassionate approach. Think about it. People coming for vein treatment might be in pain, worried about how it looks, maybe anxious about procedures.
Yeah, it can be stressful.
Totally. So real compassion, good communication, it builds trust. Patients are more likely to follow instructions, report issues. It directly impacts how well the treatment works long term.
That makes sense. It's like the expertise and tech are the tools, but the compassion is how you make them truly effective for that person.
Precisely. It creates a sort of holistic system.
Okay, building on that expertise point, the source also mentions his years of experience in treating varicose veins, spider veins, and other venous conditions. So, does this mean he's focused on one tiny area, or is it broader? What does specifying those conditions tell you?
That's actually a really important detail, listing varicose veins, spider veins, and other conditions. It signals he covers the whole spectrum. Varicose veins are the big, bulging ones, often causing symptoms. Spider veins are smaller, more cosmetic usually, but can signal underlying issues.
And the other conditions, that sounds quite broad.
It is. It could mean things like blood clots, venous ulcers, chronic venous insufficiency, more serious stuff sometimes. So treating all of these suggests he's not just, say, a cosmetic spider vein guy or only focused on big varicose veins. He understands the whole system.
Ah, okay, so it's comprehensive.
It's exactly comprehensive within the specialty. That depth across different vein problems means he's probably seen it all, understands how different issues connect. It reinforces that exceptional expertise's idea. He's managing the whole venous system for his patients, not just patching up one part.
That really clarifies the expertise angle. It's
Yeah.
deep and broad within his field. Okay, now let's talk about how he puts this into action. This part I found really interesting. The source says he combines state-of-the-art technology with personalized treatment plans to deliver outstanding results. Can you break that down? Why is that specific combination, tech plus personalization, so powerful?
Yeah, this is where it really clicks, I think. State-of-the-art technology. So we touched on that. Advanced ultrasound for diagnosis, mapping the veins precisely, seeing exactly where the problem is, and then those minimally invasive treatments like laser or radiofrequency for fixing it. Precision, less downtime.
So the best tools available.
Right. But here's the key. Those tools are only as good as the plan behind them. That's where personalized treatment plans come in. Every patient is different, right? Their specific vein issue, their health, their lifestyle, even what they want out of the treatment pain relief versus cosmetic look.
True. No two people are exactly alike.
Exactly. So a personalized plan means Dr. Sethi isn't just doing the same procedure on everyone. He's using the tech, the diagnostic info, and tailoring the approach. Maybe one person needs ablation plus sclerotherapy. Another might need lifestyle changes first.
So he's adapting the tech to the individual.
Precisely. He's crafting a unique strategy using the best tools. It's that combination, smart tech, applied smartly and individually, that leads to outstanding results.
Got it. So it's not just having the fancy machines, it's the intelligence in how they're used for each specific case, like a custom solution every time.
That's a great way to put it. Custom solution. It elevates the technology beyond just being a tool.
Okay, that makes perfect sense. And this focus on the individual seems to flow right into the next point, the patient experience. The source emphasizes this quite a bit. It says, patients consistently praise Dr. Sethi for his professionalism, clear communication, and ability to make them feel comfortable. When you hear that kind of consistent feedback, what does it tell you about what patients really value in specialized care? It's more than just fixing the medical issue, isn't it?
Oh, absolutely. These aren't just, bonus points. They're fundamental to good care, especially in potentially stressful situations.
Spur.
Professionalism, that's
Yeah.
the baseline, right? Feeling you're in competent, ethical hands builds immediate trust.
Okay, yeah, essential.
Then, clear communication. Think about it. Medical stuff can be confusing, scary. Explaining things clearly, what to expect, answering questions. It reduces anxiety massively. It empowers the patient. They feel involved, not just like something is being done to them.
That's huge, feeling heard and understood.
Definitely. And then making them feel comfortable. That goes beyond just being nice. It's the whole environment, the way procedures are handled, reassurance. When patients feel comfortable, they're less stressed, they cooperate better with instructions, maybe even heal better psychologically and physically.
So these elements, communication, comfort, professionalism, they actually contribute to the medical outcome too.
I absolutely think so. They build trust, reduce stress, improve compliance. It's the human side of medicine, and it's critical for success. It shows he cares for the person, not just the veins.
It really paints a picture of care that's technically excellent, but also deeply human. That combination seems rare, maybe.
It can be, but when you find it, it makes a massive difference to the patient's whole journey.
So all of this, the expertise, the tech, the personalized plans, the patient experience, it all leads somewhere. The source concludes, his reputation as a trusted vein doctor is built on a track record of successful outcomes. The go-to specialist for safe, effective, and lasting vein treatment. That phrase, track record of successful outcomes. What does that really signify as the ultimate measure here? Is that the final proof?
Yeah, I'd say it is. That track record is the objective evidence that everything else we talked about actually works consistently. Successful outcomes means the treatments provide real relief from symptoms like pain or swelling. They look good cosmetically if that was a goal. And crucially, the results last. Low recurrence rates, few complications. That's the tangible proof of quality.
And being the go-to specialist, that sounds like earned trust.
Exactly. It means doctors and patients trust his results are reliable. That reputation isn't built overnight. It comes from delivering those safe, effective, and lasting results again and again. Those words, safe, effective, lasting, they set the standard. That's what top-tier care should deliver. It validates the whole approach.
So it's like a feedback loop. Great skills and care lead to great results, which builds trust and reputation, making him the go-to guy.
That sums it up perfectly.
Yeah.
It's earned credibility based on consistent, high-quality performance across the board.
Wow. Okay, so wrapping this up, it's been really illuminating to unpack what's behind that best vein specialist title for Dr. Sethi. It really boils down to that blend of deep, comprehensive expertise, using advanced tech in a really smart, personalized way, and combining all that with genuine compassion and clear communication that makes patients feel comfortable and heard.
Exactly. And I think the big takeaway from looking at this source is that true excellence in any complex field isn't just one thing. It's that whole package.
Yeah.
The skills, the modern methods applied thoughtfully, and a really focus on the person receiving the service, their experience, their long-term results. That's what seems to build that deep trust and top-tier reputation. Technical skill plus human connection.
Absolutely. So a final thought for you listening. When you're looking for any kind of specialist next time, maybe think beyond just the basic qualifications or a quick recommendation. Will you look for signs of that deeper, comprehensive knowledge, how they personalize their approach using the best tools, and maybe just as importantly, how they prioritize making you feel understood and comfortable? Considering that full picture expertise, technology, and that human element might just change how you find the right expert for you. Thanks for joining us for this deep dive. We'll catch you on the next one.